Hi, my name is Leslie Friday, and I'm a staff writer with BU Today. Welcome to today's live chat, and I'd like to welcome our guests today. If you'd like to each introduce yourselves, give me your name and title, please.
I'm Dr. Margaret Ross. I'm Director of Behavioral Medicine at Student Health Services.
And I'm Dr. David McBride. I'm the Director of Student Health Services and Assistant Professor of Family Medicine at Boston Medical Center.
And I'm Elizabeth Douglas. I'm the Coordinator of Alcohol and Other Drug Programs Outreach and Treatment at BU Student Health Services. I'm a licensed clinical social worker and a licensed alcohol and drug counselor.
Great. So obviously we have a great panel of experts today to talk about health risks and drinking on, off campus, around BU. We do have questions coming in from the article and also from Twitter, I believe. So the first one is, I know drinking is usually a stress reliever for me. What are other ways to relax without overdoing the drinking? And anyone can jump in.
I can take that initially. The Fit Rec is a great resource for students, and I hate for that to be cliche, but I think exercise is a really excellent way for people to de-stress. And I often hear students say, I don't have time to exercise, but even taking 15 or 20 minutes out every day to do a brisk walk, preferably outside, is a great way to relieve stress. I also learned in medical school that a great way to stay away from stress is to plan your time effectively, because I think if you leave things go to the last minute, which I still have a bad habit of doing, but you tend to feel much more stressed and pressured because you haven't kind of taken care of things along the way. And those are fairly canned answers, but I think, as I've gotten older and gone through different levels of school, I think I've realized how important those things really are, even though they sound a little trite.
I think doing anything that you enjoy as well. So anything that you find enjoyable, taking the time to do that, whether it be to go to a movie or to, there's so many things to do in Boston that are not alcohol related. And it's a wonderful city to be in, and it's so accessible, especially from the BU campus. So you have a wealth of opportunity for you.
Yeah, I think using your supports, friends, and sometimes family is really important. Sometimes just taking a mini break and just looking around at the beautiful leaves and taking a deep breath of fresh air. It's amazing how just taking a tiny little mini break like that can just allow you to kind of decompress. Mm-hmm. And also not using too much caffeine, which students sometimes can do. People don't realize how much they're taking that in, and that is going to make people feel a lot more jittery. And then they need something, they think, to help them to calm down.
And then the interesting thing about alcohol is, while it may make you feel less stressed, quote unquote, in the moment, the way your body reacts to alcohol, it interrupts your sleep. It can make you feel more jittery, more anxious the next day, particularly if you've been. So, you get sort of not a lot of bang for your buck, so to speak, with alcohol as that kind of stress reliever.
Another question that was posted below the article is, in this week's first story, students in the video said they didn't think BU students drank that heavily. But do you think evidence supports that they actually do? Is it more than average? And what is average?
I think that BU students drink similarly to other college students nationally. I would say that about 30% of BU students don't drink, which is the national norm as well, or don't drink on a typical weekend night. And so I think that there's always the perception that